A big question we get is the difference between a bulged disc and a herniated disc. This video's whole purpose is going to be about a bulged disc. Before we begin, we need to first talk about what we're looking at and the anatomy involved. So we have a spinal model here. This is a bone or a vertebra, okay? Here is a disc, a spinal disc, and a spinal bone or vertebra, right? A big common misconception is people think that the disc is a shock absorber. Reality is, its purpose is a spacer to allow the nerves to come out of the spinal column, okay? The disc is made up of fibrous tissue to hold the spinal nucleus inside of it to create that space between the discs. Now, the curve of the spine is actually what creates the shock absorption mechanism for us when we jump, move, run, etc. So let's go back to the anatomy of a bulged disc. A bulged disc is when there is some kind of degenerative process or trauma in which the disc has actually gone outwards completely around the vertebra. All right, it's what we call circumferential. All the way around is a bulged disc. That puts pressure in the anatomy space there where there's ligaments, muscles, tendons that attach in that area, and that can cause pain. A bulged disc can cause a lot of symptoms very similar to a herniated disc. Research shows that a herniated disc is more troublesome than a bulged disc. Both are of concern, but in terms of the severity of it, a bulged disc is less severe than a herniated disc. The symptoms can be very similar to both of them. A bulged disc can cause localized pain, decreased range of motion, fatigue, and it can cause the severe symptoms such as numbness, tingling, and radiating pain. There are multiple causes of a bulged disc. The biggest one is degeneration. Degeneration is a repeated trauma over time, such as a bad habit, or you fell a long time ago and you never got the problem fixed. It's kind of like us here in Nebraska. We have a lot of wintry conditions. Sometimes we slide, we hit a curb, that can affect our tire, that can either bow our tire, can affect the tire axle. And if we never get it fixed, over the next 10,000 miles, that can cause problems. That is very similar to a bulged disc. We can have a trauma to our spine, such as a fall, somebody hit us in a car crash, work habits, or bad posture over time can put stress on that joint, which then could cause a disc bulge. The biggest question we get is, what is the best treatment for a disc bulge? And honestly, there are so many of them. It really depends on your clinical presentation and what the imaging is. If you have a bulged disc, the only way we can truly diagnose that is via MRI. And we do MRIs all the time in our practice to make sure that we clinically diagnose you properly. Because how big the bulged disc is, how severe, the chronicity of it, how long it's been there, will determine your treatment plan. We have many treatment plans in our office. The first one is a very specific, neurologically-based, gentle chiropractic adjustment. No twisting, cracking, or popping. In essence, we simply realign this vertebra or the spinal bone to get it into proper place to take pressure off that joint space. Another one we do is we do electrical stimulation to release muscle tension to allow the body to get back into proper alignment with the adjustment to take pressure off that disc. The biggest one that we see in our practice is actually spinal decompression. It's actually a decompression mechanism that allows the joint space to open up to make room for that disc to kind of suck back in, for lack of better terms, to take pressure off that disc and allow it to retrain it with spinal exercises, therapeutic exercises, and nutrition to get those ligaments strong and healthy again to hold the disc in its proper place.